Welcome to the American Institute of Healthcare Professionals Videogram on Holistic Integrative Care and Herbs. My name is Mark Moran. I'm the Assistant Executive Director with AIHCP, and I'm filling in for Dr. Dominic Fleury. Holistic care is something that is becoming more and more common in the West. Individuals are looking for answers for many ailments that Western medicine sometimes doesn't give a full answer for. So individuals look to herbs. They look to many other ways to find cures for the particular ailment that they are dealing with. And this is both good and bad because obviously many Eastern herbs have many benefits, but it can also be a detriment when individuals just look for something magical, a magic pill that can solve all of their issues, and they do not take professional guidance when integrating these complementary herbs with an existing pharmaceutical prescription itself. So holistic integrative care is something that really needs guidance. It can't be something that someone reads about on the internet about a particular herb and then goes on to self-medicate themselves. Holistic care in itself is attractive because it looks to treat the full person. It doesn't have many negative side effects. It looks to find balance within the person. In Ayurvedic medicine, it looks to find balance. In Chinese medicine, it looks to balance yin and yang. So it's not just targeting one particular symptom, but it's actually looking to cure the entire individual. It looks to balance the system. It looks to treat more than just the system and to produce an overall wellness. So those are three very important points to look at when looking at the importance of holistic medicine and what it is. Herbal remedies in themselves, when utilized, are complementary in nature. They are preventative and they are also natural. And many of them can be used in mild cases themselves. They are complementary in that they supplement. And it's very important to understand that they supplement. They do not necessarily replace. Many individuals will, without notification or guidance from a healthcare professional, maybe go off a prescribed drug, which can be dangerous because that can lead to various withdrawals. They will go off a prescribed drug and try to replace it with an herb. Or in some cases, maybe they will supplement the herb with an existing prescription, and this particular herb may have a counter effect. So they are complementary, but they need to be used under the guidance of a medical professional. They are preventative in that they're more useful over the long term than for acute situations themselves. So if one is looking to lower blood pressure over a long span of time, then a particular herb that works with that would be the best option. But it wouldn't be something that would replace, again, a prescribed drug, but it would be something that would be used under the guidance of a professional over a long-term time to prevent high blood pressure, possibly. Now, the most attractive thing with herbs is that they're natural and that they do not have some of the side effects that many pharmaceutical drugs do. So many individuals are looking for that natural effect, the core of the plant itself, which does not come with all the negative side effects that are listed on many synthetic drugs. So obviously, there are many herbs that can help individuals, but when misused or not understood, they can cause problems. Now, for centuries, these herbs have been used for a variety of issues, from flu to depression to anxiety and stress itself. What we are going to do for the remainder of this video is look at some of the common herbs and how they are utilized by professionals who help individuals through chronic illness. Echinacea is one such herb. It's a cone-shaped flower herb, and it treats actually flu symptoms, coughing, fever, or sore throat, and it enhances the immune system. So if individuals start to feel a cold coming on or a flu, then they turn to this particular herb of echinacea to find some relief from it. But of course, if something persists longer, then one would have to resort to more traditional methods itself within Western medicine. Kava kava is another useful herb, and it's used to treat anxiety. And many individuals have kava kava in their kitchen cabinet. It is a type of tea that some individuals use to deal with an anxious day that they might be experiencing. It comes from the pepper tree family, and it soothes the amygdala and it improves mental functioning. Unlike other synthetic tranquilizers and benzodiazepines, kava kava is non-addictive. However, even though it's non-addictive, it doesn't mean that it should be used for long periods of time, and it definitely should not be a replacement for a particular drug that might be prescribed. So again, this is where working with a medical professional who has an understanding of both East and Western medications and how they counteract is extremely important. St. John's wort, or hypericum, is another type of herb that helps with mild cases of depression. And it should not necessarily replace a prescription such as Prozac, Luvox, or Zoloft for more major depressions, but it can necessarily maybe supplement if a medical professional deems it as a useful tool. Again, it's natural, so it's not going to have many of the side effects that one would see with Prozac, Luvox, or Zoloft. St. John's wort works with the brain's neurotransmitters. It helps them work more smoothly and more efficiently itself, especially works with serotonin, norepinephrine, and dopamine centers of the brain. Being a drug that can reduce depression, it also lowers the level of stress and the hormone cortisol in doing so. So hypericum, or St. John's wort, is a very useful herb in helping individuals deal with mild cases of depression. In regards to stress itself, ginseng is the answer for many. It's an adaptogen type herb, and as an adaptogen, it is not harmful to the body at all. It helps reduce stress and helps improve overall bodily performances and functions. Ginseng promotes better increased activity in the adrenal and the pituitary glands. And it can also, because of this, lower cholesterol and reduces the chance of heart attack. However, since it functions with the adrenal gland, it has a special connection with that, it shouldn't be used for anxiety itself. Now, on the market, there are the Asian varieties, the American varieties, and then the Siberian variety, which is really actually not part of the ginseng family to begin with. Now, others might have issues with insomnia, and they would like to have something else of an option than many tranquilizers and sleeping pills, again, which can have many negative side effects. And valerian is an excellent source as a way to find a particular herb that is natural, and it can naturally sedate one against insomnia, to help one with insomnia. Other soothing herbs that can help with sleep are chamomile, California poppy, hops, and passion flower. But valerian is one that is primarily used, and again, one should not replace a particular pharmaceutical drug unless one is directed so by a medical professional. Another herb, and the final one that we're going to look at, is ginkgo. And ginkgo is an excellent herb for mental functioning, and it comes from some of the oldest living trees in China. And in doing so, this herb looks to improve mental functioning by enhancing oxygen and blood supply to the brain. And obviously, this is going to help with memory, anxiety, depression, concentration, and various other issues that are all correlated with mental functioning. So those are a few herbs out of many that one can investigate. But again, it is important to understand what holistic medication is, holistic alternative therapies are, and how they're utilized. They're not a magic pill that just resolves all issues. They're in fact complementary, but they can be negative if not utilized properly. They can counteract each other or counteract a particular prescription. They should not be just simply used as a replacement for a prescription either. So individuals cannot self-medicate or play doctor with these types of things. There's many benefits to them. They're natural, they're preventative, and they're holistic, and that they treat the overall person. But without the proper guidance, the proper medical guidance of an individual who understands holistic and integrative health, then an individual can cause more damage to themselves than actual good. So AIHCP offers a 4-year certification in holistic and integrative health. It's open to healthcare professionals, primarily nurses, but it's open also to other licensed professionals in the counseling areas and so forth who might be interested in learning more about holistic health and the use of herbs in treatment of individuals. Here is our information, our link, our number is 330-652-7776, and our email is info@aihcp.org. So I hope this short video was informative and a little helpful on what holistic care is, how to utilize holistic and integrative care in one's lifestyle, and the importance of not self-medicating, but finding a professional to help guide you with these particular herbs. I'd like to thank you for listening and have a good day.